one of the most effective ways to treat constipation is to deal with dehydration, especially waking up. Hi, I'm Dr. Mona Morstein. I've been a naturopathic physician for 36 years. If you're new to my channel, please click the subscribe button below. Otherwise, let's get going on today's talk, which is 8 ways to help control constipation. So, constipation is a really common problem with up to 30% of the population struggling with it regularly. I've read in the Merck manual, which is this very comprehensive guidebook on many different medical conditions, that, well, if a person says they just have 3 bowel movements a week, that's normal for them. And I mean, that is this massive eye roll that I have regarding that. That's idiocy, and it's just wrong. Basically, every day, all of us should have that good bowel movement formed and feeling that you have evacuated your entire colon. That's what we should have. Passing a bowel movement is 1/3 cells from your intestinal tract, 1/3 food remnants, and 1/3 bacteria. We detox through the bowel. We get rid of many things our body no longer wants. It's really vital that we have at least one good bowel movement a day. Now, constipation is diagnosed when you don't have that nice bowel movement every day. You might have a bowel movement, but it's small, or it's little rabbit pellets, or forgive me, but what else is the term? Duty balls, right? It's unfulfilling. Or you really need to strain to have it pass. Or you could have many really small bowel movements a day, which is frustrating for sure. Now, there is this chart that many people know called the Bristol stool chart. Now, this was created in Great Britain in 1997, and it's a well-known qualification of different stool types. Now, numbers 1 to 3 are more constipated. Number 4 is that nice sausage formed, easy to pass, complete bowel movement. That's the ideal. And numbers 5 to 7 get more into the diarrhea type of stool. So Bristol 4 is always our goal. Constipation can cause, significant discomfort and even lead to other medical conditions. People feel very bloated and heavy. They might have more flatulence. Sometimes there's a lack of appetite because you just keep eating, but nothing is coming out. You're like, oh, I don't want to put anything else in. With the straining or with the pressure of the stool that can't be passed, there's a huge risk of hemorrhoids and anal fissures. Also, constipation is an etiological factor for getting diverticulosis, which are little pockets in the lining of your colon, which can get infected and then cause diverticulitis. People can get bad breath or skin rashes as the body is trying to detox, and a main way through the bowels isn't happening. There can then sometimes develop stool obstruction that at times may need to have a person hospitalized. In children, when they're constipated, particularly, other stool that can be loose can get around it and cause incontinence, what we call encopresis. And last, another risk is a rectal prolapse from that straining to get that stool out. Now, in conventional care, most practitioners will simply direct a patient to go on some type of laxative, which will force a stool to come out. It's not curing the etiology for why you have it, but it will cause a stool to come out. There are many different kinds of laxatives. There's the stimulant one, such as senna and cascara and rhubarb. These are herbs that we call like a cathartic laxative, like Ducalax has senna in it. Bulk forming is more soluble fiber, which is actually a very good thing to do. It's not obviously a drug, but there are osmotic diarrheas that bring water into the colon to have a bowel movement, like Miralax, polyethylene glycol, glycerin. Also, other osmotic ones are the magnesium. Are you taking magnesium to have a bowel movement? Guess what? You're just taking a laxative. That's magnesium hydroxide, which is milk of magnesia, magnesium oxide, magnesium citrate. The lubricant ones are like mineral oil. We don't use that too much. And then the stool softeners, which bring water in, ducasates, and then the prescription drugs that we call prokinetics. And these are not forcing contractions of the colon wall like the stimulant ones do, but kind of just helping to pass the stool otherwise, such as Linzess and Amitiza and Motegrity, prucalopride. So these are drugs. Now, for some patients who have what's called chronic idiopathic constipation, and sometimes we cannot figure out why this is happening. If we have just some person who literally will have a bowel movement once a week and every single thing we do doesn't seem to be effective, and they've got this really resistant chronic idiopathic constipation, then taking a drug like prucalopride might actually be helpful for them. But let's first look at what does a naturopathic physician do to figure out what is causing the constipation. Of course, first, I would look at a dietary. Right? What makes a person have a good bowel movement? Well, more veggies, more fruits, more whole grains. The highest source of fiber in any food is beans, peas, and lentils. And many people don't necessarily do this. They want to make white rice. They don't eat beans. They're not really getting many veggies in, right? And so people really can just not be getting the fiber in their diet that they need. Now, fiber, we need to get around at least 30 grams a day. If you have a cup of beans, you can get 18 right there with the beans. Adding in then another 2 grams for an apple and other ways that we get the veggies and the whole grain. So, but if we're not getting those innate aspects in, it's going to be pretty hard to get any kind of fiber. Do you know how much fiber a typical American gets a day? Between 10 and 12. You're not going to really have a very good bowel movement with that, because fiber really helps push the stool through. Now, we also want to do fluid. One of the most effective ways to treat constipation is to deal with dehydration, especially waking up. Now, if you sleep for 7 or 8 hours, say you didn't drink then, you wake up, maybe it's a half hour, you probably didn't drink anyway before bedtime for at least 2 to 3 hours. So when you wake up in the morning, you may not have any fluid in you for 10 to 11 hours. Try going through the day and not drinking for 11 hours. You're going to feel really dehydrated, and that's what your body is. So one of the quickest fixes that work for a vast majority of people is to wake up in the morning and first thing, literally drink a liter of either room temperature or warm liquid. A liter, not a glass, 8 ounces, but 32 ounces, ideally with a little lemon in it. Why? That's because lemon will cause the liver to dump a little bile into the gut, and that kind of signals the colon, and we better get rid of the previous day's stuff. So drinking a liter of water when you wake up, you're going to feel better. You're going to deal with dehydration right away. And all that water is going to really just lubricate the gut with water and have a bowel movement take place. Another thing aside is to do tests. For example, could you have constipation because you have SIBO? SIBO-methane is a very constipating overgrowth of bacteria, say fungal overgrowth in the small gut or the colon. That's a very constipating organism that can be causing constipation. Also, food sensitivities. For example, people can eat certain foods that they just don't digest and causes constipation. And in that regard, so we want to potentially do tests and see if we can figure out what is the microbiome like in the gut and could it be causing constipation. Another thing to consider then is digestive enzymes. I mean, just to share about myself, if I eat, a piece of meat, I take one digestive enzyme with that and then I'm fine the next day. But if I don't, I could be constipated from it. So apparently I like eating meat now and then, but I can have some problems digesting it. And so taking a digestive enzyme just seems to be everything I need to keep that process going smoothly. And so some people, for some foods, are not well digested. Generally, that is protein or carbs. It's not fat. If you don't digest your fat well, it's going to be diarrhea, loose stools. It's not constipating. You can get constipated from the protein or from the carbs. Now, that might be you need a little stomach enzyme for protein or the pancreatic enzymes, which kind of covers everything, right? So we could either do bitters, right? A bitter herbal formula really helps the body produce its own digestive enzymes, or we can actually either give a pancreatic enzyme with or without hydrochloric acid. Another simple constipation treatment is literally ye old prunes, right? 2 to 6 a day of stewed prunes or some prune juice, 4 to 6 ounces. Oftentimes will just take care of it for people. Of course, there's other sources of fiber, such as just taking fiber powder, right? So fiber powder with psyllium in it. Psyllium is a very good fiber for having a bowel movement. Generally, we're looking at soluble fibers, but any kind of fiber can be helpful. There are these really great gummies, unsweetened gummies called Kiss My Keto Fish Friends. They're a little bag, and their little bag is 80 calories, but that little bag of gummies is 31 grams of fiber. So sometimes I take those when I go traveling because it can be a little more easier for me to get constipated traveling because I don't drink as much, where's the toilet, blah, blah, blah. But a bag of those is giving me 31 grams of fiber. There's also carbonate bread. So carbonate bread, I get the gluten-free. One slice is only 40 calories. And again, it's 15 grams of fiber. So these are easy ways we can enjoy getting fiber into our body. And probiotics and prebiotics, sometimes we just need a probiotic. And some patients can really just getting the probiotic in, getting some prebiotics. The probiotic is the actual bugs. The prebiotic is what feeds the bugs and that makes them grow and diversify in your intestinal tract. So sometimes just getting something to get that microbiome healthier will work. And the last thing, again, cup of coffee. That's why a lot of people drink that cup of coffee is to have a bowel movement because it increases peristalsis in the colon. Finding out the reason for constipation is important, and then instituting a comprehensive protocol is going to help the majority of patients with constipation. So thank you for listening. I'm Dr. Mona Morstein. If you like this, please press the like button or subscribe. If you'd like to see me as a patient, please find my info in the bio below. Thank you.